Thanks so much, Greg, for the opportunity to speak and to share from the experience that we have in Africa. My friend and I, we were supposed to be here to share together, myself and Dr. Nusrat, but she's a consultant, public health doctor, and at the moment in Nigeria, because the cases are kind of increasing, so she's gotten a state appointment now from the state government to be able to look at ways in which they could identify and certify various COVID centers in the state, in those states. So that's why she's not able to make it here. And a big thank you to Professor Jane South, because you've just helped me to actually lay the foundation of what we do in our Precious Gems. So who are we? Precious Gems is a charity that was set up in the UK in 2013 to help improve the health and well-being of women and girls in the community. Now we use 3 key strategies. Now we identify the individual strengths and passions. And next thing, we also identify their physical assets. That means maybe the things available for them, their lands, the things that they have within them and within their community. But the third thing is that we utilize these individual and physical assets to meet their identified needs, leading to a sustainable development. That's kind of in line with what Jane has been saying. And we actually operate, everything we do at Precious Gems is based on the asset-based community development approach. And this approach basically, it talks about, this principle talks about, is draw strength from the existing community networks to build a stronger and a more resilient community. And these assets that we're looking at are basically shared into 5 key assets: the individual gifts and talents, the associations like their churches, their mosques, their faith groups and all that they belong to, the institutions within that community space, like the government, like public health, like the hospitals, the police, and their physical assets like their lands. But one key asset here, the 5th one, which is very important, is the ability to actually, first of all, they identify their problem and connecting all these identified assets to actually solve their problem. So that was why that 5th point, which is the connection, which is very, very important. And that's why we need people within the communities who we call the connectors. Now, these are the people that understand what goes on in the streets, and these are the people that are very vital in this role. The strategy we use, the Precious Gems, basically are 3, these are the strategies. We look at a community, we connect them. But we've observed that through connection, people tend to get inspired from each other, from what people do. And when they get inspired, they also tend towards being empowered. And that empowerment leads to more connection, inspiration. So with that one, that serves as a circle. And these are the foundation upon which Precious Gems has been set up. Like I said, we are focused on women and girls, both here in the UK and in Africa. But now we come back to the issue that is troubling everybody right now, which is the COVID-19. And so we want to focus a bit on our work in Africa, specifically in Nigeria. Now, for Nigeria, the first case, the very first case happened on the 27th of February 2020 from the patients who came from Italy. But as of yesterday, the cases have increased. As of yesterday, right now, the update total, so far in Nigeria is that we have about 4,787 confirmed cases. 959 of them has been discharged, but unfortunately, we've 158 deaths so far. Now, these are basically the things that we're looking at. Now, the background to why we now say, okay, let us look at what we're doing. The Nigerian government, like every other government, has been looking at measures for them to actually look at the COVID-19, which is the things like the social distancing the identified case being isolated, hand washing, wearing of masks, respiratory hygiene, travel restrictions, the active detection. Then the government too has done their very best to be able to equip hospitals, train staff, provided needed medical materials, and activate screening sites. Now, from that approach right now, well, we've also identified some challenges. Now, based on what has been said before, there is this needs approach whereby the government at the moment right now will work through institutions which have a top-bottom approach, but there is a gap that has been created. Now, the government action is not far-reaching in the sense of the information, because without adequate sensitization of recognition of symptoms and prevention, the residents within the rural areas, so that means their approach basically at the moment right now is not actually targeting those within the villages. It's not reaching those within the rural communities, because most of them don't have access to all these facilities. And then the next one, in the country, there's a great, part of the problem in Nigeria right now, there's issue of poverty. There is no power supply. There's no power supply, meaning light. There's no lights to power things. There are no palliative measures for basic amenities. Then most of the population, they actually depend on their daily wages. And this is very difficult for people. And that's what's causing a lot of people not to be able to adhere to the lockdown. Then the relevant channels through which information are being passed on through the public is not being utilized. Because if you go back to Africa, like what Professor Jane mentioned, there is a gap in the sense that from the communities, they have traditional routes that people can communicate. Like in Africa, we have the chiefs or the kings. The kings talk to their people, and then the people can pass information across that somebody on the streets will be able to hear the information. We have faith groups, we have different groups. Now, those traditional groups where information are being channeled are not at the moment being utilized before, and that on its own is actually creating a gap. The government strategy for the COVID-19 to be effective, this community gap must be covered. Now, that's where Precious James, therefore, is attempting to address some of these local, this gap in local communities by actively disseminating relevant information through the traditional channels. That's why I have to emphasize the traditional channels, whereby we are looking at utilizing the asset-based approach by building by community to community from bottom-up approach, looking at the grassroots level, working with the connectors so that they get the information that we can work up, while the government can go on doing theirs from the top-bottom approach. With that, we will be able to meet somewhere, and we're able to complement each other's efforts. So in the process, we're actually educating persons on COVID-19 prevention and using on the way to use their protection measures, recognize symptoms and signs, so that they can be able to see when they find these signs and symptoms. So they'll be able to refer themselves to the clinics that are there. And secondly, we are also seeing how we can engage them by engaging the local assets there to produce PPE equipment, because funds are not really being made available because of the level of lack of finance. And also, we should not forget the issue of government corruption. So the government may make available certain funds, but the officials may siphon the funds or embezzle the funds. And at that time, those beneficiaries will not benefit from anything. So that's where we as the charities, we end up coming to fill those gaps with the little information we have. Now, the approach wanted to say, okay, for us as Precious Gems, now that we want to see how we want to engage, let us first of all hear, what are the members of the community actually saying about this coronavirus? How is it affecting them? How is lockdown actually affecting them? So we actually spoke with our team in Nigeria to do a video collection of Nigerians from their homes to talk about their perception of the coronavirus. So I'm going to share with you a video of what our team created, though Just hold on. Though the video was done from their phones, but at least I hope you enjoy it. Just hold on.
Hello everyone, my name is Oge Christine Jamaka. I'm making this video from Lagos, Nigeria. I'm the DCE and a volunteer of Precious Gems Africa Foundation. A foundation caters to improving the lives of women and children in Africa by providing support. But this video is not just about women and children, it is about everybody. In our bid to appraise the effects of COVID-19 spread in Nigeria, we have compiled videos made by Nigerians living in different parts of the country, made from the confines of their homes, talking about how the spread of COVID-19 has impacted on their day-to-day lives, their businesses, their finance, their security, and whether the lockdown imposed by the government has been effective in curbing the spread of the virus. Please watch and I'll be right back.
This is a new thing. This is a learning curve for everybody. People are not used to staying indoors for this long.
Still, as much as it's happening, it still looks like it's not happening to us. So that's probably why people are still going about. And most people don't even have, this is a third world country, most people don't have a conducive home to stay inside. Some people don't have food.
The whole stop, everybody just, trying to survive whatever they are doing. People are going about their businesses and doing whatever they have to do to survive, to make a living.
You can't ask people who do daily business, who get their money as they go out, to just be seated in the house without anything happening. The federal government should have made provision for these people even before they even thought about locking down our various communities in Nigeria.
They are trying to make ends meet. Most of these people, artisans, market women and men, they earn their income per diem, so it hasn't been easy at all. So in as much as it's safe for every one of us to be inside, most people are inside and they're hungry.
Where local governments depend solely on daily pay, like the traders, the keke riders, the bus drivers, so they have to go out to make ends meet.
The issue of jobs, people like us who do normal jobs, normal daily jobs. I'm a lawyer by profession. Now I don't remember the last time I made money, but I keep spending money, which to me is not ideal. I keep spending money because I've not made money, and the more you sit at home, the more you spend more money. I feel that the government should have taking all these things into consideration before coming out with the total lockdown. Because the fact that countries are locking down doesn't mean that Nigeria should lock down. There are countries who have not locked down, and they have been effective in this fight. The USA, the Canada, and some other countries that locked down, there were already arrangements for provision of taking. I don't want to use the word palliative because people don't even understand what that word means. So there should have been a proper arrangement on how people should have been taken care of. It has affected our job, it has affected the community, it has not even achieved the desired result. So if there's any attempt by the government to want to lock down for another 2 weeks, because I've been hearing it is being bandied across, please, the federal government should not go that route. We can fight this COVID-19 to a standstill even without locking down entirely, because it has not really achieved the desired result. Thank you very much.
I'm a small business owner, and I know that I'm going to have to change the way I do everything post-COVID, because even now it's not even easy to get the attention of the people, your prospective clients, because everybody's worried about their jobs, about their future, about their children, about everything, this life, about at this time in life.
It has affected me so far because I cannot even move back to Lagos State to go about my business, but it is what it is. I think the world is revolving, so we should have to adjust to the situation right now. All we hope and pray is for God to take this pandemic away.
I work in media and marketing communications, and a lot of my work involves consumer contact, both online and offline. So as you can imagine, the offline aspect is highly impacted by this virus. At this point in time, people will just go against the lockdown. So for this to actually happen, the government has to put some things in place to keep these people up until the lockdown is over. Thank you.
On my government aspect, we need to double up in sharing palliatives and resources that will aid people. Because what I've noticed is majority of the guys who are out on the streets, who are hawking or who are trying to sell, they live on a daily wage. How do you expect them to stay indoors when that's the only way they can survive? So if you are actually sharing palliative measures, if you're actually sharing palliatives, you should double up, ensure that there's there are a lot of hands who are helping to share it so it gets or it reaches people faster. Because personally, I haven't received anything. My neighbors haven't. No one on my streets that I know.
Nigeria is a country where the cost of governance is really high, yet the effect of governance is none. So a lot of people feel like they're really on their own, so they don't trust the government because the government doesn't seem to really care about them. So they think staying indoors is doing the government a favor, and they don't want to starve. So a lot of them come out. So there's a lot of need right here. A lot of people need support.
I expect the governor, I expect the Mr. President, I expect the House of Assembly to properly handle things that regards security.
But at this time, everybody should stay safe, stay indoors, wash your hands, keep the required distance from people, avoid parties, eat well, and just, thank God.
The government just need to take a very drastic decision. After May 4, whatever the governor wants to do, have to take a very, very hard decision.
And even we have to come out in the main lines to protect ourselves and our family due to the robbery around the streets.
I've not heard of any robbery case as a result of the COVID-19. Everywhere is peaceful, everywhere is calm, but I cannot tell for the next 30 days.
Security over very okay. No cases of robbery or burglary. It's been relatively okay.
Security is okay in this area, at least for my own area. I haven't heard anything, though we've been hearing of the 1 million boys who have been planning to attack.
The security, well, it's been okay. Kwara has always been a cool town, so it's just been good like that. It's just that more people need to be assisted to get more.
Of course, security measures on the government's part is very, very important. Now, of course, as a community, we have our vigilante, but there needs to be policemen and security patrolling, areas, especially in the night, because we've had a lot of reports and cases in other communities where people are revolting, going from house to house, trying to rob, or just basically cause commotion. So this is the time for the security, that's the soldiers, policemen, this is the time for them to actually patrol these areas. They should be placed in the, entry points into estates, and even around, they should be, littered strategically around the area.
Thank you so much for watching. Please remember to always maintain social distance, wash your hands regularly, use a sanitizer, and adhere strictly to all the recommended guidelines. Stay safe.
So thanks so much for that. Let's go back to the. So we as an organization, we want to say, okay, as Precious Gems, now that we want to do our intervention, let us gauge what the community has said. And from the video you've listened, you've heard what the people are actually feeling at the moment, their current impression about COVID. And so we now said, okay, if that's the case, let us focus, because in Nigeria, we have 36 states in Nigeria. Okay, let's narrow down to one particular state, Edo State. The reason why we chose Edo State is simply because we have our office base there, and we have our network base. So we want to start from there. And now, within Edo State, we wanted to look at, because we have about 19 local governments in Edo State. Was okay, fine. Let's look at let's narrow down a bit to about 4 local governments, which is the Eastern Central, Eastern West, and the Eastern Northeast and Eastern South. And we have a number of volunteers who are who've given their time and their energy to support us in this. We have the doctors from the public health doctors, we have nurses, we have members of the Red Cross, members of the local government, and all that. So these are some of the people that we wanted to start mobilizing, them from the grassroots. And the target groups that we were looking at were basically the kings from the local government areas. Like I've said at the beginning, we at the moment the government is applying a top-bottom approach, whereby they just look at institutions, call public health and different places to just talk to people. But the point is there is no bottom-up approach. And those at the bottom, basically at the grassroots level, so we needed those connectors. And where the connectors are could be things like the kings, who are local kings, who are kings in that area, the chiefs in this local government. Because once they understand what's actually going on, they will be able to utilize their well-tested networks to be able to pass information across to people within their domain. Then we look at the faith leaders. Now, in Nigeria, faith plays a huge part in Nigeria. So the three main religions are either the Christians, the Muslims, and those who are non-Christian and Muslims. And it's very important that because of the religious background, most of the citizens tend to listen very well to their pastors or their imams. Then another very interesting group that we look at to target basically are the commercial motorbike riders or the keke riders. Now, because of the level of lack of development, poor roads, the most common source of transportation in that area are the motorbike riders. And because of their strategic position, they come in contact with a lot of people and they deal with more of the customers. And so if there's going to be transmission rates in terms of contact, that could be one huge area where they could do that. But also in terms of information dissemination, they also play a key role too, because since they hear what people say, their passengers say, so we want to utilize them as connectors. When we get them on board, they will also serve as ambassadors to be able to further cascade this information. Then the marketplaces within the local government areas, then the police. Why we mention the police? Because they are actually front line in terms of crimes and things. But one of the problems that they are facing right now is because of the issue of corruption. Most of their equipment are not being given to them. So you have a police officer that is almost completely non-equipped. So this period right now, the police people are tending to go out there, no PPEs. And so this is something we targeted them, and schools too at the moment. So these are the target groups. Now, wanted to look at from the grassroots in terms of the bottom-up approach. How do we get people so that once they get involved, looking at their assets and their skills to be able to participate in supporting the communities? And we observed there was the issue of a lack of PPEs, which is the personal protective equipment, face masks and all that. So what we did was that we engaged the local tailors, women who do the sewing. So, okay, fine. You know what? Instead of waiting for foreign imported face masks, we can actually develop our own face masks. And so we supported them. So now, if you notice now from the picture, they're actually sewing face masks that we're actually distributing to thousands of people within the community so that they'll be able to stay safe. Now, like I've mentioned earlier, within the community, there is no running water. Within the whole, most of the local governments don't have running water. So people so in terms of like hand washing techniques and how to safe hand washing techniques and all things like that, there is no running water to do that. So what we have done now, we've engaged the local craftsmen to be able to design these Veronica buckets, which are which is available and for two purposes. One, we use them as demonstration to the communities that we go to on how they can be educated on safe hand washing, but also in these strategic areas, we also put these buckets there so that people can always top it up and have something that they can wash regularly. So this is the reason why we've designed these buckets, which will be sent around all the communities at the moment. In terms of the engagement, we can see at the moment, this has some our team members who are actually educating the king of Iroa at his palace and his chiefs. So we are educating them on the signs and symptoms of COVID-19. One, how to do safe hand washing, the way to identify signs and symptoms. But that's one. But also strategically, because they are actually the gatekeepers, because they are actually the chief connectors, they on themselves also will help to disseminate this information through their own traditional network to the community people. And this is one of the strategies. And so this is the king of Iroa, who's listening. Then this is one of the police stations that we went to. So we were actually also educating the members, and we also made donations of face masks for them. So they'll be able to understand the safe hand washing and the way to communicate more with the members of the public. Here, this a member of our team. She is actually demonstrating how to do safe hand washing, and this is at the palace of the king of Igweben, and this were his chiefs. Now, these chiefs that they're looking at, they are chiefs with the king, but they also have their own sub-communities under them. So the information that they hear here, most of them already promised that they will help to disseminate into their own neighborhoods and the areas of which they have their commands over. Here we see some members of our team who are actually at the police area command in Usugbenu. Now, these are some of the leadership from the police who are actually being taught on safe hand washing, educating them of the signs and symptoms of COVID and the ways to actually say if they identify something, so they know how to make the adequate referral to the hospitals that have been done. And here are some members of the bike riders. So you can see a member of our team is actually demonstrating how to do safe hand washing for the bike riders. And also all these places that we've been to, what we do after educating them on safe hand washing and the signs of COVID and all, we also make sure we donate free face masks for them. Like this particular group, they are very vulnerable because they carry passengers all the time. And although the face mask does not prevent, but at least if any of them have the COVID, at least because they have their face mask, it kind of minimizes the rate of transmission to their passengers. And they were very, very grateful for what we've done. These are some members of our team that are actually addressing the palace of the Ekboma, the king of Ekboma, sensitizing them about COVID and its prevention. Now, I mentioned the faith groups. At the moment in Nigeria, there is lockdown. That lockdown prevents all churches, no gathering to meet. But at the moment, the Muslim community within Nigeria are still holding their mosque sessions. So some of our team went to visit them across their mosque. So this person that is currently washing his hand, he is the imam of the mosque at Ekboma. So we did a presentation session with them. So he is practicing now on safe hand washing. Though the picture only just showed him, but he actually has his members who are actually looking at him, and then they will be able to disseminate this information from what they've learned to the communities. Now, from the information that we've been, because of us going out and sharing with the community, we also gathered feedbacks from them in terms of what they felt. And here are some of the feedbacks that we got from them. Some of the information they had said was that number one, we are not getting any support from the government. So they're not feeling any support whatsoever from the government. And that also ties down to that top-bottom approach, one. Number two, not identifying the role of the communities, the role they play as assets within the community. And the next question that they also raised, which is very common, was that you are the first to explain to us what COVID really is. There's no information being going around, so most of them don't even know what's going on. And if you don't know what's going on, then there's also a high chance that there is going to be increased infection rates. Then the third one of the common things we also noticed was that your organization needs to do more for us to help reach our people. And these are some of the things that we are doing. At the moment, we are using volunteers, and from most of the things that we do right now to support the community are actually donations from volunteers to be able to, which is something the community. And then the next one we also looked at was that we cannot comply to the lockdown because we are hungry. And from that video you notice, the Nigerian society is not designed like Europe, whereby there is a safety net, whereby people can get benefits. No, most people depend on daily wages, and there's a high level of people being hungry there. And then one of the most common one that we also heard was the issue of we fear hunger more than the virus. Because to them, the issue is that if you're at home, you can't do anything, and you are hungry, then you will have to take a chance. So most people are now actually taking chances to actually go out there in the streets and break the government's rule of staying at home so that they want to just eat, just have basic food to eat at home. And that also brings a challenge to what approach really is the government doing? Because one of the questions that was being raised based on what we are doing is that, can we develop a kind of a unique approach, like a Nigerian approach, rather than copying and pasting what we see in Europe? Because in Nigeria, the communities don't have the same safety net measures as they have in Europe. So that's why this at this point of like saying we fear hunger more than the virus. For us as being an organization, we've been out there working with partners, beautiful partners. But for today, our own ask is that we are looking at collaborative partnership to further support our work, because there's so much on ground to be covered. And secondly, we are looking at opportunities for joint research to utilize utilizing our platform, both here in the UK, Europe, and Africa, because most of these things that we are going out, there's a huge opportunity because some of them we're actually gathering data, which could also serve as a foundation for research based on the COVID experience. And like what Professor Jane mentioned earlier, there is life after COVID. So some of these techniques that we are teaching the communities, they're on their own, so they are learning it. At the moment, it could prevent COVID, but though there are other effective conditions, right? That's those safe hand washing and the way that can also help to support, to also prevent. And that's one. But then number two, the point about post-COVID in terms of building community resilience, building networking, strengthening the networking within the community. Because for Nigeria, what we depend on solely is the community resilience, is the community networks. Friends talk to friends, neighbors talk to neighbors. Those are the things that we can help to strengthen with our own actions. Thanks so much for listening.
Thank you very much for that talk, Oboh, and for providing insight into what will be a very different experience of the pandemic to a lot of the people watching. I've just got a few questions before we move over to Gillian's talk. So one of the questions that's come in, as you mentioned, about people talking about the lack of government support, but is there any sort of government or municipal support available for community-based workers to carry out their activities?
Well, I'm sure, yes, there are. But what we find on ground, why you can see NGOs is that if you look at the Nigerian context, there is we have the COVID pandemic right now, but actually there's already an endemic issue of corruption. So that's where the real problem is. Because the government could be on paper announce we give $10 billion or any amount to something. But the question now is that most times the money does not trickle down to actual activities because government officials could embezzle the money and it does not get to the grassroots. So that's what the problem is. And that is why it now forces us as the charities to actually come in and see how we can actually plug those gaps. So yes, based on the announcements, they've announced that yes, there are measures they've put in place, cash has been released, money is being released, yeah. But people on the ground are not feeling any impact. So it's the issue of endemic corruption in Nigeria. Thanks very much.
Okay, and just another couple of questions. Just somebody's asked, are there certain populations that are being disproportionately affected by COVID in Nigeria?
Okay, I would say, first of all, those within the local communities, the rural areas, those within the rural areas, and even those within the urban area, like the video we posted right now, that was not from the rural areas. That's from Lagos itself, which is a city of 20-something million people. So that's urban. But at the end of the day, you still find out that those at the upper class level, they are not so, because they are educated enough, and then they have the resources, so they could be able to stay at home. But those at the middle class and the lower income, they're the ones that will have that risk of actually going out and breaking the rules and being exposed. But at that point, that we also need to identify again, the COVID virus did not come into Nigeria originally. It came in through the upper class because they're the ones who travel abroad. So that is another interesting dynamics. But now that is now local in Nigeria right now, the rate of spread will be more towards those people who cannot afford to stay at home, who cannot afford to actually, observe the measures in place. So it's just two ways. Who's more? I would say it's both, really, because those in the upper class are the ones who travel, who are more exposed, who brought it into the country in the first place. But those at the lower level, who are poor, who cannot do anything, will be those who actually get the worst hits because they cannot stay at home, because they have to go out. And they have made up their mind that, look, we prefer, to face the virus than to face hunger. So there's a huge risk there. And there is a high chance that the number of the infected cases and maybe possibly deaths in Nigeria will keep going high just because of this imbalance. Yeah.
Thank you. And then we've just got one final question for you. So what do you think will be the lasting implications of COVID for everyday life in Nigeria?
Oh, the lasting implication is that things will change. The way things are being done prior to this right now, a lot of people, like for example, in terms of because there'll be two implications. One, the health-wise, because people now are more conscious, of this. Yes, of course, the system is not very perfect at the moment. Even the system in Nigeria is trying to adjust to a new way of doing things, but at least we could end up developing our own format of engaging, but that's one. But the economy implication, that's the real problem. Because at the moment right now, Nigeria is an economy that is solely dependent on crude oil. And at the moment right now, the last time I checked, crude oil is less than $1. And the country that budgeted his budget around maybe $50, $60, now you're getting almost zero. That's already a huge problem coming in. So post-COVID, there could be a lot of job losses, so many things. And that was why, if you look at the video we shot, we specifically identified security. Because right now, people, especially those low people are at home, nothing to do, no jobs. So what's going to happen? And there is no palliative measure and no government safety nets. That's already pushing people into crime, into insecurity. So these are some of the problems that we are going to see. But on the positive side, it's making people to now rethink the ways that they used to approach things. Like, for example, now people are going more into online now, and people will now start looking at how to put their hands in new trade, at the moment. So there are so many opportunities in terms from the community level, and also it kind of will build more community resilience, because people can talk to each other right now. And so these are some of the things that are bound to happen. But like I said, it's still an ongoing thing. It's still ongoing.